those who don't know, I'm a senior medical student, graduating exactly 69 days from the Medical College of Wisconsin. I'm going to do a case presentation. This is a patient I had in my first rotation as a junior medical student. I was on the neurology rotation, and this patient came up. He was one of the first 5 patients I ever treated. The title of the presentation is Left-Sided Numbness. So DE, patient's initials, a 40-year-old male who presented to the emergency room with a sudden onset of left-sided numbness and dysphagia, which means difficulty swallowing. For the past couple of weeks, he's been complaining of these headaches in the back of his neck, radiating down to his shoulders, neck aches, and he's noticed a loss of coordination. He's not walking the right way anymore. He's dropping things. He's not himself. He's been dizzy also for the last 3 weeks. And significantly, he has chronic neck pain for which he sees a chiropractor. And his last manipulation was about a month ago. So what happened, the stroke team's consulted. His symptoms are very classic for a stroke. Based on a series of CAT scans we did, he's diagnosed with a vertebral artery dissection and cerebellomedullary stroke. And I'll explain what all that means. He's admitted to the floor for further treatment. So what's going on? Well, the patient's having a stroke. Basically what a stroke is it's a lack of blood to reach the brain for whatever reason. And there's 2 main types of stroke. You can think about it like a sprinkler system feeding a garden. The most common is called an ischemic stroke, and that's what this patient has. That's when something plugs the hose, blocks the sprinkler, and the garden starts to die. That can be a blood clot, it can be cholesterol, it can be any number of things. The second type of stroke is called a hemorrhagic stroke, and that's a bleeding type of stroke. That's when someone goes to the hose feeding the sprinkler system, stabs it with a bunch of holes, it sprays everywhere, and the garden starts to die because the flow to the end of the sprinkler isn't getting the supply it needs. So we know that he has a stroke. We have this evidence, these CAT scans, so we know he has a stroke. But what caused a stroke? Stroke is very uncommon in a 40-year-old guy. Well, if we look at the symptoms that he came in with for the past 3 weeks, these posterior headaches, loss of coordination, and the time correlation with the chiropractic visit, in diagnosing with something known as vertebrobasilar syndrome. So this is the blood supply to the brain. There's 4 main arteries that feed the brain, 2 internal carotid arteries and 2 vertebral arteries. And this is a side view of how they get up there. Now the posterior circulation feeds this part of the brain right here. Now there's the back, the cerebral cortex, this is the cerebellum, brainstem, medulla, pons. There's a lot of important stuff in here. And when blood flow is blocked to this part of the brain, you get these headaches at the base of the brain, basically all the symptoms he presented with. It's a syndrome known as vertebrobasilar insufficiency. And so what caused this in this patient? Well, if we look at these vertebral arteries, they're called vertebral because they actually pass through the vertebra. Not very intelligently designed, if you ask me. If you twist your neck in a sudden jerking motion, you can get something that looks like this. This is the first 3 vertebrae. The atlas in this model has his head turned 90 degrees to the side. So you see this artery is stretched right there. And so in anything that causes sudden movement like this, for example, chiropractic, you can get tears of this artery right here. And it's not just chiropractic. At autopsy, people who hang themselves, about 20% of patients will have vertebral artery dissection noted on autopsy. So it's not just chiropractic. There are other things that cause this, but chiropractic is sort of the classic cause of vertebral dissection. So what happens when we tear this artery? Well, the artery is actually made of 3 layers, or 3 tunics, the intima, media, and adventitia. The adventitia, this outer layer, is very strong and very elastic. You can actually take a piece of the aorta and stretch it. The arteries have to be very elastic to serve their purpose. So this is a strong outer core. However, these inner 2 layers are not very strong. So you can tear this thin layer right here, or this muscular layer right here, without damaging the outside. And so you get a picture that looks something like this. This is called an intimal tear, which is a tear just of the intima. And so you have this rip right here, blood's flowing in this direction. And in this area where blood isn't flowing, a clot starts to form. The clot expands and expands over time and eventually you only get about this much blood flow going through there. And more importantly, this clot isn't very solid structure. A piece of this clot can break off at any time, get shot downstream, and get lodged in a smaller artery. And that is exactly what happened to this patient. He has this narrowing over time, over 3 weeks, and then eventually something changed very suddenly. And that's when a clot breaks off here and goes down the stream. So it's very significant correlation between his chiropractic visit, his 3 weeks of symptoms, and then his sudden acute presentation. So let's go back to our patient.